Good evening, and welcome, and thank you for joining us this evening here on blackdoctor.org. I am Ellis Dean, and we have an interesting discussion tonight. So I'm going to set it up by saying this. At Black Doctor, what we always like to do is try to find topics and for discussions that are important to our overall health and wellness. And sometimes that moves to the cosmetic level. And in terms of when we're talking about health and wellness, we're looking at, we like to look good, you know, in our mirrors, in our minds, and to our friends and family. And so one of the things we were talking about last week is we saw an article that Lizzo made a statement. Lizzo, the artist Lizzo, made a statement, and she talked about her body image and how she was not going to let others define how she felt about her body. And we thought that was a really great, impactful, and powerful statement about self-esteem and really kind of rejecting society's notions of what is considered, quote unquote, attractive. Now, as we started discussing that further, we started moving forward and saying, okay, what role does society play in helping us or hurting our own self-image with regards to our bodies, particularly when we're looking at social media? And we know when social media started, and it's amazing to think that Instagram has only been around since 2010. But it has become an integral part of all social media, not just Instagram, has become an integral part of how we interact with one another and the messaging that we want to send out to the world. What we put on social media says a lot about who we are and what we believe and how we see ourselves. And so when we see others, is that impacting us? And so we know about all of the body shaming that happens on social media and the bullying that happens on social media. So now we're going to talk about what that means with regards to how far people are willing to go to look good on social media. So we came up with a 3-part series it's called Instagram Bodies, Blessing or a Curse. And tonight is part 1. And part 1, we're going to talk about plastic surgeries, the do's and don'ts of plastic surgery. So we've got a wonderful panel of guests tonight. We're going to talk to a millennial about social media and the impact it has on their lives. And we're going to talk to a couple of surgeons, and they're going to talk about what it means and what that surgery process goes through. And then finally, we're going to talk to Dr. Dickerson, who is a plastic surgeon, and he's going to give you really what you should know about plastic surgery, what's safe, what isn't, and what you should be doing, and all of the process that goes into having surgery. So I know you didn't sign on to listen to me talk all night, so I'm going to move on to our first guest. But before we do that, I want you to let us know where you're watching from. So in the comment section, put where you're watching from. We'd like to see where you're watching us from. And if this is a discussion that you feel like somebody else needs to hear or learn about, or you find this interesting, tag a friend, share it with a friend. We'd always like for you to tag and share it with the friends and let people know what we're talking about here on blackdoctor.org. Finally, if you have a question throughout tonight, if you have a question that you want to ask of any of our doctors or even of our millennial, make sure you put that in the comment section as well. And we will make sure we'll try to get your questions asked. We won't get all of them asked, but we'll try to get your questions asked. So first up, we have Ms. Jade Curtis. She is our millennial representative. How are you doing, Jade?
I am good. How are you, Ellis?
I'm doing great. I don't know how to say it any differently. This guy just called you our millennial representative. I'm
a betweennial, I like to call myself. I'm technically not a millennial.
Okay.
I did not grow up with an iPad. So I'm the betweennial, okay?
Okay, right. Betweennial. Okay, I got that process down. Okay, so a betweennial. So question, as a betweennial, how much time do you and your peers spend on social media?
Well, before I actually got on this live, I actually went ahead and took a look at my screen time on my phone just to make sure I was actually seeing, okay, how long, because earlier I cut it off because I didn't want to see it anymore. You know how it pops up at the end of the week. So I went ahead and took a look for this live, and it's actually about 18 hours a week, which is a lot. But if you really think about it, it's like an all-inclusive place. So we're not just scrolling. I mean, we are just scrolling, but it's where we get our news. We shop on there. It's entertainment. So I don't know. I just feel like it's not as bad because we're doing a lot of different things on there.
Absolutely. And so if you're watching us, just drop in if you know how much time, or if you have an idea of how much time you're spending on social media. I'd love to see that in the comment section, just to kind of see a gauge of how much time people are actually spending on social media. So 18 hours, that is a lot, because if I could do the math, that's over 2 hours per day on social media. So when you say that, but you are doing multiple things. You're on Twitter, you get some information from Twitter. There's TikTok with all the videos there. You've got social media, which you've got pictures and videos and all the other kind of stuff. And so I get it, but that's 2.5 hours a day on social media. So what role does that time on social media play into how you see, issues in the world?
Well, social media kind of is how we see our issues. Most of us don't really watch the news. We're definitely not picking up a newspaper. So it is how we see it. What they show us is pretty much how we take it in. But it also gives us an opportunity to feel like our voice is being heard. A lot of us speak out on social media about social issues or whatever the case may be. So it does give us a larger platform. So yeah, it's how we receive our information, our issues, but it's also how we speak about them and address them and share our opinions.
Okay, so that brings an interesting point. So it's how you see the world. So now, when we're talking about pictures and images on social media, those pictures can be altered, whether it's by special lighting, the right angles, Photoshop, and up to and including surgery. So how much of those pictures that you see on social media, how much of those things that you see on social media do you think are real or are altered in some way?
Well, I think it depends, I guess, on what you mean. Because I would say 99.99999% of images on social media are altered, even if it's just a minor filter, adjusting the brightness. I think almost all of them are altered in that way. But some of them do go a step forward. I know some people use something called Facetune, which allows you to, kind of bring some things out, pull some things in. So, or, just brighten some things up, alter some things. So those, I think, are kind of I think that's more so what you're referring to.
Mhm.
Those are, I really can't gauge, I guess, how many I would see, probably more than I think. But yeah, most of them have gotten something touched up on the image for sure.
Okay. So, um, does it matter to you that the pictures may be altered in some way?
To me, no. I use filters on pretty much all of my pictures. Actually, I think every single picture on my Instagram has a filter. Even when I post stories, I'm using a filter. I don't know, something. So I don't think there's anything wrong with it. Maybe I'm just used to it. But I did see a post recently that said to take pictures of yourself without filters because later on in life you'll appreciate it. And I did start taking pictures without the filters, but they're rarely posted. So most of them are altered to
Okay.
me.
So why are they rarely posted?
Um, let's not get too deep right now. Let's No, I don't know. I think we're just used to just having that perfect perfect, like you said, the perfect angle, the perfect lighting. Just those minor tweaks just kind of, I don't know, it's just a better experience. You get more interactions. I don't know, maybe I'll try it out.
So that's a good question we're going to pose to our audience. So do you take unfiltered pictures, or do you take filtered pictures, or doctored in some way pictures on social media? Do you post them on social media? Or are you always worrying about your angles or your lights? Or do you just say, hey, I took the picture, I'm posting it. It is what it is. So let us know in the comments. We'd like to see what you're doing and how you're responding to social media. So here's the question. Do you know someone that's had some procedures done, not just angles or photoshops, but actually had physical procedures done on their body to make themselves look better?
Excuse me. Yes, I know some. I don't know anyone who's had plastic surgery personally, but I do know some people who have had the non-surgical procedures,
Okay.
and those are interesting. In the
Okay.
most positive.
What do they have done?
So I had a friend who had what is it called? I've had a friend who got cool sculpting done, which is like they take like this freezing thing and it
Right.
freezes your fat off. I've had another friend who had body cavitation, and I think it's like a ultrasound machine. I don't know exactly how that process works, but they rub it on your stomach, and it kind of
Okay.
shrinks your waistline. And then I've had another friend who had vacuum therapy to get it's a non-surgical BBL, Brazilian butt lift.
Okay. Okay. And so in your opinion, well, I don't know. I want you to remain friends with them, so I don't want to ask. Do you think it improved their appearance?
I mean, yeah, I think so. Yeah, I think it definitely made them feel better about themselves for sure. It gave them the results that they wanted to see. They went back for 2 of them. I think they went back twice. For the BBL one and the body cavitation one, they went back a couple of times, and they got the results they wanted to see. They felt really good about it.
Okay.
And I've thought about it for myself, the body cavitation one for sure. So
Okay. So it sounds like it's twofold. It's one that it makes them look good outwardly, but it also makes them feel good about how they look and how they appear. Okay. All right. So now that we know that these procedures are non-surgical, they seem to be becoming more and more popular. You think it's just kind of going to be part of the culture now? It's just going to be part of, hey, if you're, trying to, because we all know you can monetize, if you get the right number of followers, if you get the right number of likes, you get the right number of fans, you can monetize basically being on social media, whether it's YouTube, whether it's Instagram, whether it's TikTok. We've all seen it, and it's become part of our norms of society. So when you know you can monetize this, do you think that more and more people are going to try to go that route of having these procedures done in order to increase their number of followers, increase their number of fans, increase their number of likes?
well, it's interesting that you say that, because everyone who's gotten that done is one of those people who does want to increase their followers, likes. They want to be, a TikTok person, or a TikTok influencer or Instagram influencer. So
Right.
I don't know, maybe for that community, probably so, maybe so, but they're also working out too. So I think it's kind of like that first step, and then they start working out. And so now that they're already there, they want to maintain it. So I don't know if
Right.
it'll be a regular thing, or if it was just to kickstart their journey with weight loss or their body goals.
Okay. So, and this is the question so you think that they would choose that route more so than just the traditional route of diet and exercise?
I think it depends on the
Mm.
person. Well, when you ask who is they,
The people,
are you?
the people that are trying to monetize Instagram or try to get more fans and followers and likes and things like that, do you think, or even in general, just people in general, they say, hey, look, if I know if I can go to Cool Sculpting and shave some inches off my middle, why would I want to go to the gym, for 2 hours a day or 4 hours a week? Why would I go to that when I could just go to the Cool Sculpting and get a 30-minute procedure done and I could take inches off my waist?
Hmm. Yeah, I totally think it just depends on the person. I think it depends on the person's discipline, because dieting and working out is all about discipline. And I think with these procedures, it does skip a step. So I think it just depends on a person's determination, their discipline, and their dedication to achieving that goal. So it's just all about the person.
It is. It is. So we're going to bring in another person to kind
Okay.
of help move this conversation along, and that is Dr. Wita Brown. And Dr. Wita Brown is an orthopedic surgeon. So we're going to talk about that process of surgery in general, because she's not a plastic surgeon, but we're going to talk about what that process is of consulting with somebody about surgery, and what is that fine line between the repair, just for simple repairs, or that maybe that vanity piece, which says, okay, I want to be able to do this, this, and this. And so, Dr. Brown, welcome to the program.
Thanks for having me. Hi, Alice. Jada? Is it Jada or Jade?
Jade.
Jade, okay.
We leave Jada with the pinkets and all that. This is Jade. So, as a plastic surgeon, what are your thoughts when you heard Jade talking about, people using these procedures, being more, I guess, intentional about creating the perfect look, for lack of a better term, on social media?
Well, I think it depends because it can be dangerous. You want to be careful who you go to for these procedures because all of them have risks. We know of people who've had plastic surgery, maybe not at a hospital, but like the strip mall, and they end up passing away. So there are risks with any procedure, no matter how small it is. I always tell my patients the common risk, and one of them is death. Anything that involves anesthesia, you could die. And I specifically say that and write it on my consent. I remember I was a resident and a patient had a carpal tunnel, which is a minor procedure. You usually can do it with just mild anesthesia, but the patient was too nervous and wanted to go to sleep. Patient passed away, had a complication after surgery. It was a plastic surgeon who actually did the case. So he had to go and tell this lady's husband that the patient had passed away from a minor procedure. So you never know what could happen. And so do you want to take that risk for just a cosmetic procedure, something you really don't need to have? So there are risks involved.
Right. Okay. Okay. So have you noticed any amount of changes in terms of people, taking, like, maybe electing to choose surgery as an option, to even if it's just a minor sports injury or a minor something that could be treated with maybe like a cortisone shot or physical therapy? Are you seeing an uptick in people just going ahead and choosing surgery over other methodologies?
Not really, not. I'm more conservative, and I always give people the option of doing conservative treatment, unless it depends on the issue. If it's an athlete or someone who wants to return back to their sport, I'm more apt to offer surgery versus more conservative treatment. But I'm more conservative than most people just because there are risks involved with surgery. So it's a risk-benefit ratio with everything.
So is that when you're sitting down with your patients, that's what you do? You talk about kind of the risk versus the reward of surgery. The recovery factor for surgery is obviously longer than it is from, a cortisone shot. But basically, what is your process in terms of when you sit down, you consult with a patient and give them their treatment options with regards to surgery or not?
Well, it depends on the issue. Some things have to have surgery. There's no conservatives. Let's say if you had an ACL tear in a young person, I would say that's surgery. ACL in an older person may be a little different because they may be more sedentary and they don't do that much. So they may be stable. So it's a different conversation with them. Do they want to risk 9 months of rehab, the surgery, and they're not active at all, versus someone who's 20 and have arthritis, is playing basketball, they want to get back to their sport. So it's kind of a no-brainer that they want to have surgery, even though it has risks involved.
See, I'm going to be a little personal at this point because I'm feeling some kind of way. Because when I tore my ACL a few years ago, right, my doctor gave me the option, right? And so maybe I'm thinking he was trying to sneak tell me I was a little too old to be out there running around. And he said, look, because he basically told me, he said, you don't need an ACL. You can go walk straight and run straight. It's when you try to cut that when you need that ACL to stabilize the knee. And he was like, are you trying to play some more? And I was like, yeah. Well, why wouldn't I? And he was just like,
that's a part of the discussion. He was trying to see, like, do you need your ACL? If you was like a couch potato, you might not.
I tore a plan, and I think, but to this point, to our discussion tonight, I don't want to get too far off of it, but for our discussion tonight, I think that's the part that we're talking about in a way, because the vanity piece said, I want to continue playing because I didn't want this to ruin, I didn't want my playing days to be ended by this. When we're talking about it, in terms of social media, when we're talking about angles and lighting and procedures, how much of that, role, and maybe Jay, this is a better question to you. How much of the role do you think vanity plays into that in terms of making people take that extra step? Okay, I've got my lighting, I got my right angle, but maybe if I do this one thing else, then I can get more likes, get more followers, get more fans. And, is it a slippery slope? I guess this is the question.
Sorry, I was on mute. I think, And I think it's a little bit of that, and also it's beyond that too. I think people do want to feel good about themselves, like outside of other people's perceptions as well. So even if it's not just about taking a picture and they decide to, you know, get whatever cosmetic procedure, I think that they just kind of want to look in the mirror and see something they like as well.
Okay. All right. So I think what we're going to do is we're going to bring in Dr. Edward Dickerson, and he is our plastic surgeon. Dr. Dickerson, good evening.
Good evening. How are you, team? You guys looking great.
Thank you.
Well, you just enhanced this whole panel discussion, you know, so we're four for four in terms of looking good. So I think, so Dr. Dickerson, you've heard our discussion tonight. What are your initial thoughts when you hear us talking about, you know, that social media imaging, body imaging? Should we get procedures done to look better, and how much of it is real and how much of it is kind of what we are looking for in terms of how we want to feel about ourselves?
Yeah, social media now is all encompassing. As Jade said, it is not just a place where we just get entertained or just distracted. It's where we get our news. It's where we actually evolve, you know, our political, you know, thought processes, how we get our education. What do we keep up with? It's new and it's fast and it is constantly moving. You know, even for us as physicians, depending on what space that you're in, you know, the old thing of a billboard that was static, now our websites are static. And it's actually social media, depending on how we want to communicate with it. It is a very, very powerful tool. And so from that, we can actually have our own influences to provide good information, so that we can educate our folks so they can make an informed decision, whether that's for an elective procedure like an ACL, or you're coming to see me to make the boo-boo scar a little bit better because you want to feel good in your Bermuda shorts. But
Right.
like I said, social media is a very powerful tool, and it can also be a very dangerous tool as well, depending on who's behind it and in front of it. It also gives us that option of anonymity, which we have to be very careful of too, because the question is, what responsibility do you have when you put something out there in the universe? And the difference is, as three of us on this panel, we didn't have social media in college and things of that nature. So, you know, we kind of ran around a little anonymity too, but now everybody has a camera to include our, you know, our patients, even in consultations. Can I FaceTime my friend in? No.
That's hilarious. So have you noticed an uptick in terms of people seeking procedures over the years as social media became more and more commonplace in society?
I don't know if there is truly an uptick, but there has something that we call the Zoom effect, even just recently, and that
Okay.
is because we've been spending all this time on these Zoom cameras, Jade. I'm sorry, without a filter, and they started realizing that they were like, I'm not crazy about looking at myself 8 hours a day.
You
And
know,
you
I've
look
heard that
out,
in a couple of meetings before. I've actually heard that.
yeah, and you know, I mean, how many? I've had people, you know, turn their camera off if, you know, if they're having a bad hair day, or you know their beard wasn't tight, and that is because, you know, now you have everybody's command decision in this little box, and you know they're like looking at you, and you know you need to trim those hair, you know. So there is a definite Zoom effect, especially for us facial plastic surgeons. And it actually came with more of those non-surgical treatments to include wrinkle relaxers and wrinkle fillers, or even, you know, how do I thicken my hair? But when it comes down to it, that's what we've seen recently, the Zoom effect. But the other thing that was actually very, very interesting when we were all locked down, and now we figured out how to do work without going into a brick and mortar building, guess what? All of a sudden, a lot of people had recovery time available as well.
Yeah, so you could get the procedure done because you were going back home. You're not.
I mean, think about it.
That's
We
true.
could do a breast augmentation, a tummy tuck, liposuction, and guess what? Here I am at my meeting the next day, and you don't even know what I've had based on this angle. Or even better, the person, whether they are ethnic or of color or not, all of a sudden the opportunity to, let's say, do a lip filler or to do a scar or even a nose job became really, really convenient because here's my immediate recovery. Right?
Oh, yeah, yeah.
So all of a sudden, elective procedures became very convenient.
That's true.
Right.
And now, think about it. How many people actually savings account went up because you weren't driving, you weren't basically, spending a whole bunch of money at Starbucks because you weren't making that commute, and you
Right.
saw a lot of people had a significant amount of money that was just there. And I've been thinking about this a while. Now I have the means to do so and the recovery, and I have not even missed a day of work. For those of us who do elective stuff, we were okay with that.
Okay. Okay. that is interesting. I didn't even think about that. So the Zoom effect. I do think about the Zoom effect because I've got these lines, Doc, that I might want to talk about going forward. Appreciate that.
Yeah, and let me tell you, and I will tell you, and if Jade or even Dr. Brown, even in her practice, believe it or not, there were some things that we were able to do better as physicians, whether you do elective procedures or not. We got back the ever important house call. And now my consultations are in the privacy of your own home. You're on your
Oh,
own home turf. Your kids are running around or your husband's there with you. But more importantly, now you did not even have to get up off your couch to even talk to a professional, whether that's do I get my ACL done or not. And for me, it was much more personable because you had my undivided attention. My nurse wasn't getting me. I didn't have anything going on. And what I could do literally in 10 minutes, I couldn't do maybe even an hour if you walked in my practice. So we've become much more efficient. We've been much better stewards to our patients, at least in my practice now, as well as we've seen some of the others. And so that has really, I think, done a better service for our patients.
okay. So let's talk about plastic surgery. What are some of the things that people that are considering plastic surgery? What are some of the things that they should be considering? What are the do's in terms of plastic surgery?
As Dr. Brown said, good North Carolina girl there, appreciate you. Do your homework, okay?
Okay.
Now, the homework can maybe start by an introduction with social media. And, there are a lot of individuals out there that have a very good social media reputations.
Hmm.
And it's not just basically the shock effect or watching some surgery. And so the thing is, the question is, okay, I'm concerned about something as simple as, I'm losing my hair. Okay, I'd like to
Right.
thicken my hair up, or I'd like to lose weight. What are some of my options? And so very quickly you can get on, your social media and see what's going on, close by. What is the trend? And you can get some information very easily, literally watching the Olympics right now and kind of figure out, hey, this is something I can consider, and then look for those things locally. But when I say do your homework, once you've kind of decided that this may be something to consider, I always would tell people, look to consider somebody locally. The great thing about that is you've got a homegrown, professional in your backyard. Make sure they do have the right qualifications. Make sure that they have the right credentials, whether that's the needle or the knife that I would say. So the needle is, of course, for your Botox or your fillers, and the knife is, of course, for cosmetic surgery. And so one of the best things how many of us do, how many people, look, we don't even buy a pair of shoes without looking at reviews on Amazon. So check the reviews and look for those trends, okay? Um, most of us have, as good physicians that do good work, have good reviews. You may see a blip out of there a little bit. Come on, people. If the person is not happy, they have also the right and the access to say what they want when they want. It doesn't necessarily make them right, in my opinion. But look for those trends and talk to some people around there. Look for other forums. And then the neat thing is you can actually have a virtual consultation without getting up off your couch. So do your homework, check their credentials. For me as a visual surgeon, you just want to see, you want to go to my before and after pictures and go, that looks like me. I want that. Just like you would do a car or a dress or a pair of glasses. And so, and then you have that opportunity to check those out. But you really need to do some serious research. You know, like I said, whether you're looking on something on a shopping site and you spend hours before you get a car, or 18 hours a week before you're gonna, buy that next, purse or suit or even where you're traveling, do your homework because there's enough information out there you can figure out if that entity, that surgeon, or that procedure is actually worth it or maybe a little suspect.
All right, so we've got do your homework, check their credentials, look at their work. I think that's number 3 is look at their work to see, 'cause they'll put it out there, and if you see a nose that they've done that or an augmentation that they've done that fits what you're looking for to have for your body, then that might be the right person for you. I would ask this question: should you ask them, how many procedures of this type do they do on a, is it something that they do on a regular basis, or are they like, you don't want to go to a breast doctor that's more, you might want to not want to go to a doctor that's usually doing breast when you're looking for a nose, augmentation. So should
Correct.
you ask how many of these surgeries they're doing?
I think that's a good question, but I'll even give you the audience out there some better questions. Now, understand that you're going to be, interviewing the surgeon, but also the surgeon is also, when you do come in for your consultation, I'm sure Dr. Brown can relate to this. We're interviewing you just as much because this is a relationship that you have to take some responsibility for. And so the questions of how many of you had these done? Well, what's the difference if I've done 10 or let's say 1,000? Does that mean I'm a better surgeon at that? Remember, all of
Mm,
us who are board certified have met the standard to do what we do. We have some procedures that we like to do. We have some procedures that we are very good at but are not crazy about doing. And then there are some procedures that we love to do and we are good at it. And you know, and just like if you have a partner, I have somebody that does an excellent job of doing breast work. I do a lot more faces. Why? Because I like it. I have more experience with it, and so those things as well. The questions I get: have you had any complications? Well, Dr. Brown, you and I both know there's only 2 surgeons that don't have complications: ones who don't operate and ones who lie. Okay, we've all had complications, very minor ones and some major. But the question that you want to be able to know, whoever you're interviewing, is if you do have a complication, can you manage that complication? Do you have the facilities to do it? Do you have credentials to elevate my care if I need to, whether that's admission to the next level, or do you have this in your office? So you want to have that contingency plan, that what if. Those are great questions to have. Not that, and do you have complications, but in the event that I have an issue at home, can I call you? Will you answer the phone? Do I have
mm,
access to your practice 24/7 on the weekend? Or how can I get in touch with you versus do I have to leave a message and wait till the next day? Well, of course, you can't get that if you were traveling to other places. And there are plenty of places, and I have colleagues all over the country who do fantastic work, who people travel to see. I have people that come to see me all over the country as well. But we are always very in tune to where you stand. How can I get in touch with you to make sure that you're all right? And do we
right.
have the means if there is a contingency? How long are you going to stay with me if you're traveling, let's say, from Michigan or Alaska? I live in a huge military town in Fayetteville, North Carolina. So I have people coming from all over the world to come see us or visiting their families. So those are great questions to ask, because the surgery is actually the easiest part of all of this. Okay, most of us surgeons, we've done this with with little or no sleep. We've had a lot of experience. We can take care of those problems. The
I don't know if you
question
should be
is
admitting that.
what if?
Hold on,
That's
that's
our training. That's our training.
that's your training. Okay, okay, that's part of the training. The no sleep surgery training. I got you. Dr. Brown, I see your head shaking up and down. Is he hitting it right home in terms of when you're talking about the point that he made about when the patient's interviewing you? Are you also interviewing the patient before you decide to go down that road of surgery with them?
Yes, and because it also, you can do the best job in the operating room, but if your patient doesn't follow the post-op instructions, you can have a disaster. So you want someone who's going to be able to follow your directions, because in cases like trauma where you have no choice, sometimes I alter my post-op plan based on, I know this patient is not going to do this. So
Right.
it's very important that you interview your patient.
Wow. Okay. So, Dr. Dickerson, do you alter the post-op plan based on your kind of feel of what the patient is going to do? You know, what you think the patient may or may not do after post-op?
These are patients that I didn't choose, though. They had like fractures.
Exactly. So I think what Dr. Brown is actually talking about. Sorry, my camera's a little low. I think what Dr. Brown is saying that I've done a lot of things before cosmetic surgery. I was a head and neck surgeon. I did facial plastics, and I do now body stuff now. I am now the want doctor. Dr. Brown is the need doctor, and there's two different relationships that we had. And you're right. When you are the surgeon coming into the trauma room, and trust me, I still do plenty of trauma. When they go through a windshield, and we have to kind of put them back together. When they are investing that particular money to come to do something, one is first of all, you would like to make sure they have some ownership. Our consent forms are very long and very thorough. A consultation with me can easily last an hour because it is more education than anything else. And it's how you're going to protect. Let me tell you how you're going to protect your investment. And so that is very important because we want them to have a good result. We want them to have, as I say, all I am is the confidence doctor. I just help with the confidence part. And once we do that and they continue to protect their investment, they're going to get that great result. Because Dr. Brown, we know that the healing process, we only control about 50% of it is what we do technically. It's the other 50% that the patient does, their physiology and how they heal, that's really going to get the other results. So we could have an outcome that we're both not happy with, patient and the physician, and that doesn't mean that there is a blame issue. That means, okay, where are we going to go from here? And that's what the patients want to know. If it doesn't go perfect, what can you do to ensure me that I am going to be okay? And that's what we try to do for our patients, whether it's elective, trauma, or something else.
Okay, good. So here's a question. When we're talking about you're the want doctor, did you know any of the procedure that Jade was talking about earlier? Are you familiar with those type of procedures? Do you do any of those procedures, cool sculpting, anything like that?
I don't do any cool sculpting or where we actually want to non-surgical options as far as fat are concerned. My practice is a little bit different. All of those non-surgical procedures are really, it all comes down to who is the right candidate, whether that's cool sculpting, nose surgery, ACL surgery, whether we're going to do, like I said, some sort of external fixator after somebody breaks their leg. We have to figure out if they are the right candidate. Unfortunately, too many people think that, I've got $50. Can you get me to this? And I only have 15 minutes to get it done. And my high school reunion is next week. So those non-surgical procedures, once again, I think are really they're great tools. But I would always tell patients, know what it will do, and more importantly, know what it won't do.
Okay. Okay. So do you have concerns as a surgeon? Do you have some concerns about people maybe because of the cost of surgery? Because you got to, you think about if you've got anesthesia, even if it's a in and out procedure, there's still some cost associated with that. That's a little bit higher. And then I've been hearing, we know some people have been going overseas to places that had been cheaper to get those procedures done. Famously, Kanye West's mother. That's what, from my understanding, is what led to her passing, is that she had a procedure done, not in the States, but she wanted to get done, and she went against her normal surgeon's advice and went elsewhere to have that procedure done, and that ended up costing her life. So, are you concerned that people are, because they're I don't want to use the term desperate, but they're so anxious to get a procedure done, but they're willing to, take greater risks to get that procedure done at a cheaper price?
All of us who are physicians, when we go to our big academy meetings, there's usually an international component with them. Right. And so most of us have colleagues who have trained in the U.S. and even outside the U.S. who are well published and well trained and have great facilities. So unfortunately, this is where sometimes a little bit of information may not be telling the whole story.
Okay.
And so once again, I think it's a matter of doing their homework, because I know some fabulous plastic surgeons, rhinoplasty surgeons, facelift surgeons who are internationally known, who I, quote, follow and read their articles and that nature. So, but we do have to understand, a patient makes a decision whether it's for a hip replacement or, let's say, for liposuction, for two reasons, and it's value and priority. Okay. So for the individual that, once again, wants to lose weight, wants to have a little bit of a curve modified, that's valuable. But all of a sudden, priority may creep in because the high school reunion is in 6 months. I'm going to see my ex. I'm going to see my in-laws.
Right.
And so they want that confidence that they can have when they show up. Guys, we put on a suit and tie. Ladies will base their hair and their nails done, because not so much that they know that they're going to be seen, but they want to feel, which is the most important word in our vernacular, at least in my practice, is confidence. That's what they want to have. They want to feel confidence. And so sometimes that priority sneaks up and social media says, ooh, there's a sale. And all of a sudden you go, okay, I can get that flight. I can get that. But once again, I've seen some people do some fantastic work that are not necessarily here in the States. The biggest concern that I have is, if it goes well, it goes well. If it goes bad, you need to understand that patient who shows up in the emergency room or at another practice, all of a sudden you're asking another individual who you didn't choose, who's now choice 2, choice 3, choice 5, to fix a serious problem. And that we have to take on, unfortunately, the responsibility of your health risk. And a lot of times we don't even know what's going on. So you're asking, that physician who you show up in the emergency room to fix you. And he, once again, puts everything that he has ever worked for on the line to make sure that you're going to be safe or taken care of.
Right. That's a really good point. That's a really good point. And I think that confidence is, I think what's what Jade was referring to earlier, is just that when people are getting these procedures done, they feel, and even the friends that she knew, a lot of that was about confidence, right? Feeling confident in being able to take that picture, to post that picture. I've seen some of the comments that we've had on this program where people are like, yeah, I don't post a picture that's just not at least altered in some way, whether it's the lighting and the shadows. It's something that we do because that makes us feel more confident in terms of what we're putting out there, and that's representing us. And so we always want to, like my mom used to tell me, put your best foot forward. I think social media is really accentuating that process of all of us having the ability to put our best foot forward, even if it's not how we look every single day. So, Brad, I know you do a podcast. What is your podcast about specifically?
It's called Running is Cheaper Than Therapy. And it's running from a holistic aspect, some of the mental health benefits of it. And I also have other guests who have overcome obstacles to make it to their finish line. So it's tying in with running, but other sports too. Because I also do triathlons and I ski. So it's focused on sports, but from a mental health aspect.
So talking about mental health, Dr. Dickerson, when we're talking about body dysmorphia, and so as the my master's was in counseling, and it was one of the things we had to kind of learn about especially when I was counseling college students, is body dysmorphia. How much of a role do you see that very often when somebody comes into your practice seeking a procedure? And if so, if you come across somebody that you may suspect have some sort of body dysmorphia issues, how do you handle it if you suspect that is an issue when somebody's coming into your practice?
Well, first of all, for our listeners and our followers out there, let's get a couple of definitions straight. Okay. Body dysmorphia is actually a diagnosis. Okay. We use that term very loosely around here, and it's a serious label, so we all must be very careful about that. And that usually that diagnosis comes from a professional psychologist or psychiatrist who has had, the opportunity to do a history of physical and sit down with this individual on probably more than one occasion before we label that body dysmorphia. Now, that particular diagnosis is somebody who has this, whether it's, perceived or real concern about something that they don't like that actually overtakes almost their whole entity or being, because they're constantly focused on that. Okay. Now, I usually tell people, ask, well, why did you do cosmetic surgery? Or here's what I say. If you're confident, you're beautiful. You feel beautiful. You act beautiful. Whatever that is. If the tie makes you confident, wear it. If your car is clean, wear it. But here's what I tell people when they come to see me. If your car gets a dent in it, you usually take it out. Most people are like, yeah. If your house weathers and you need to paint it, do you take care of it? Well, yeah. Well, protect your investment, whatever that is. And so just because somebody wants to get some information about how they can feel if they change or modify something, then that's what's going to make them confident. Okay. For, the men, it could be something as simple as, hey, I've got this beard going, but I got this little patch here that I'm not crazy about when I take my selfies, Jade, or when I see on my Zoom effect. And so it's something as simple as that for my guys. That's not body dysmorphia. Okay, that is, I am looking to get some information so that I can make a decision that is informed because I talked to a professional. Well, and TikTok may not be the way to go to get all your professional information. Okay.
Right.
I didn't have TikTok in any of my classes, but I guess now I should have. But and so that body dysmorphia is something way on one side. Those patients that are out there, I think everybody has a concern, and it's just a matter of. And actually, we don't have to talk to the patients. I start off the conversation. What would you like to talk about? Not what problem do you have, not what's the matter. What would you like to talk about? And they'll tell you.
Okay. So it's I understand. Like when I read about the diagnosis, you're absolutely right. It's a diagnosis, and it's body dysmorphic disorder. I think that's what it's the formal terminology is, and it is an obsession, and so but it can manifest itself in a way that somebody frequently sees a surgeon or something. I think there was some kind of pseudo psychologist or psychiatrist that said that's what Michael Jackson kind of suffered from, in the fact that he kept having procedures on his face and in his nose. And so there was some thinking in some circles that maybe that's what he suffered from as a result of having those multiple surgeries on his face. And so just wanted to make sure that when we're talking about that confidence level, when we're talking about overall how people feel with regards to plastic surgery and getting a procedure done, what is that line between, hey, I want to continue to feel confident about how I look, to it is becoming obsessive. And so that's really where we're trying to find that space where it's like, what's holding you back from feeling confident at this level, and that you feel like you need to have another procedure done in order to regain that confidence in how you look.
Right. I think that, once again, and this is a part of the interview, and this doesn't come, your first day, of medical school. You're seeing tens of thousands of patients throughout our career. And after a while, we kind of have an idea when either the person we know is not going to follow instructions. We know when the person is making a decision that may not be in their best interest. As I tell people, elective procedures do not fix infidelity. They do not fix, relationship problems. They do not fix financial problems. They don't even fix spiritual problems. But I think what happens is, after a while, we are trained throughout the course of our careers, from medical school, residency, and just of our experience. When we know that you hear the term red flags that are going off, and you're like, hey, all of a sudden now their interest in what I do or what Dr. Brown's, that now all of a sudden it has become pathologic, and all of a sudden there's harm or perceived harm that I think that we feel, and we both as physicians have, the ultimate say so, and that's, no, I'm not your surgeon, and here's something I would like for you to consider if you want me to be your surgeon.
Gotcha. So as we're wrapping up this topic about plastic surgery and what are the do's and don'ts and positive things and negatives sometimes with regards to, unfortunately, we're gonna kind of get some final thoughts. Jade, as the what did you say, matwennial? That's a new term that I learned tonight, Jade. So matwennial, as a matwennial, after you're hearing Dr. Dickerson, Dr. Brown, are you more confident, less confident in terms of, people getting procedures done and being able to just how you see social media? Has social media changed for you as you see it? Are these procedures changing for you? Or what are your thoughts after you've heard, especially with Dr. Dickerson kind of breaking down plastic surgery?
Yeah, absolutely. I've always been someone who's pro plastic surgery. Do what you want to do what makes you feel happy, do what makes you feel confident. And so I think I was definitely listening to the questions. I think it's important that people know what to ask their doctors, and especially those people who are traveling overseas, whether, it's actually, a world-renowned doctor or just someone who may or may not botch your surgery. I think it's important to ask those questions and make sure that they're giving you those honest answers, and you feel a relationship with that doctor, as opposed to just kind of going and getting it and it's cheaper, and you're kind of putting your life even more at risk than, a normal procedure would. So absolutely, I've definitely got a different perspective about plastic surgery. So yeah, if I ever decide, I'll definitely give Dr. Dickerson and Dr. Brown a call.
And you gotta go to Fayetteville, but that's a short ride.
Yeah,
from where we are.
I trust them already.
Dr. Brown, I do want to talk a little bit more about your podcast, because I think it's a mental health is a really big part of what we're talking about, and in terms of mental health, not in terms of pathology, but just in terms of feeling good and feeling better and feeling confident. And so our confidence, how we how we feel about ourselves before we start any procedures really will play a big role in that decision-making process of whether or not to have a procedure done. So talk to us a little bit more about like how the impact that has had in terms of, helping people improve their overall mental health with or without surgery.
Well, I think it's interesting when we think about different procedures and plastic surgery. I think it's great if it's for your confidence, but I think some of the danger in social media is if I get this look, I'm going to get these certain number of likes. I think you should do it because you want to do it, not just because I want more likes and I want more followers on social media. That shouldn't be the driving force. Because you think about followers, I have friends who may have like 136,000 followers, and they could care less about the details about their hair and their social media. They're out there living life and running races and doing ultra races. And I mean, they're not the typical, when you think of like the perfect body, quote unquote. They're out there having fun, and people love their story. It's not about they have the perfect filter. So it's just be careful about why you're doing things. If you're doing it for yourself and for your confidence, don't do it just for more likes on Instagram, would be my message.
And Dr. Dickerson, what's your final kind of thoughts in terms of what would be your final messaging to somebody that might be considering plastic surgery, considering getting a procedure done to help their overall body image and the way they perceive themselves physically?
Like I said, there's a big old sign that when you walk in my office that says, "If you are confident, you are beautiful." And I think that is really the take-home point. And you don't have to feel confident to see me. Because if nothing more, when you walk in the door, there's going to be a whole lot of cheerleading. We do our thing like, "I see you." And that C is for confidence. "I see you, girl. Look, if nothing more, we're going to tell you how cute your shoes are." But more importantly, that's what people just want, to be acknowledged that I am human. And it doesn't matter what flavor of ice cream that I am, because we all like ice cream. And it doesn't matter what shape, whether I come in a cone or a tub or whatever. So I think that you should just feel good about whatever flavor and shape you are, because that's what makes the world go around, different flavors, shapes and flavors. So, feel good about it. But if there's something that, you're looking for, do your homework, check your reviews, and talk to your friends about it. Okay. What do they think about it? And then go from there, because there has to be also some support outside between me and the physician. And if you have everybody in your home front that's against it, you may need to kind of figure those things out before you take this big step, because you're going to need their help.
Yeah, that is true. So as we're wrapping up again, I want to thank each one of our guests, Jade Armatwenio, Dr. Brown, and Dr. Dickerson, for joining us this evening and really having a robust discussion, because that's really what we wanted to have. Talk about the do's and don'ts of plastic surgery, really talk about the impact that social media has. And I think we all are in agreement that social media has had both a positive and a negative effect on how we view ourselves and how we see ourselves through the lens of other people. And so sometimes it's just that comparative lens where we see somebody that looks great and he's like, "I want to look like that." Or sometimes it's just that how we see ourselves when we put that picture and go, "Ooh, that wasn't the best. That wasn't the most flattering picture of myself that I put on social media." And so you want that picture to look better. So overall, it's really, and I think Dr. Dickerson summed it up perfectly. We talked about confidence. Confidence comes from within. It comes before you walk into the door, whether it's a cool sculpting or whether it's a rhinoplasty. That confidence has to be there with or without the procedure getting done. And so the more confident you are, the better the outcomes will be even if you choose to have a procedure. So we're looking forward to part 2. So tomorrow, part 2 of our discussion about Instagram bodies is we're going to be talking about BMI, Black women and BMI, and is it helpful or harmful with regards to our body image. And so that we're really looking forward to that discussion, because we're going to talk a little about obesity and body image, and where does it all go off the rails with regards to BMI. So looking forward to that. Same time tomorrow, 7 p.m. Eastern. So I want to thank everybody for joining us. If you had any questions, I'm sorry I didn't get to them, but Dr. We got it covered. We got you covered. So tomorrow we're talking about BMI in Black women. I'm sure it's a discussion you don't want to miss. Looking forward to that. So have a great evening, and we'll see you all soon.
Thanks.